Welcome back. On today's segment of Viewpoint, we address North Korea's suspected COVID-19 crisis after confirming its first outbreak of Omicron on May 12th. That is precisely 2 weeks ago. North Korean authorities claim fever cases have been raging across the nation since late April. For more on the situation across the border, I have Professor David Kwak from Soon Chun Hyang University. Professor Kwak, welcome back.
Good afternoon.
I also have Professor Justin Fendos at Dongseo University live on the line. Professor Fendos, it's been a while. Welcome back.
Thank you for having me.
Professor Kwak, we'll start here then. As of Thursday, North Korea says over 10% of its roughly 26 million people have fallen ill with fever, and 68 people have lost their lives. What do these tallies tell you about the situation up in North Korea?
Well, it tells us that the situation in North Korea is quite worrisome and dire right now, because they're not detecting these cases by testing methods, but instead they're actually counting people who are coming up with symptoms. And that to constitute about more than 10% of the whole population tells us that there's a great possibility, a huge portion of the whole population is actually currently going through the infection altogether. It could be millions and millions more that are actually currently infected and still transmitting to others. And it's very worrisome because, as you know, North Korea is not so much equipped with methods to actually treat the patients, let alone treat even only the symptoms. So people who might also be vulnerable in a sense of immunocompromised people, people who are with underlying diseases, and also the fact that we know that the citizens of North Korea are currently known to be rather weaker in their capabilities to fight against infectious diseases. Makes us worry that much more that there is a possibility that many people could possibly have died from COVID-19 already, and could also possibly die also in the coming up times of the periods that are to come up. So I think North Korea has to really open up in regards to letting people know what sorts of methods that they have to fight against COVID-19, but also how they are measuring these case numbers. Plus, they would also have to open up their borderlines so that their citizens could be treated by the nations and people who has these equipments and medicines that can actually help them, that can actually have them survive through this period of pandemic. So we have to not only keep a very close eye on it, but we have to do, I think, more than that to really help this nation out, not only in the sense that helping a neighboring nation, but also in the sense that to really help our cousins and brothers.
Right. And Professor Fendos, I understand that you assembled a statistical model to forecast the potential impact of the pandemic in North Korea in terms of case counts, hospitalization and fatality rate. Now, do tell us a bit about your findings and how do they compare with the actual statistics disclosed by North Korea?
So at this point in the pandemic, we really have a wealth of information about Omicron virus. We know under different circumstances how quickly it spreads. We know for unvaccinated people approximately how likely they are to need hospitalization, approximately how likely they are to die. And the statistical model that we came up with combines all these numbers and also takes into account North Korea's age demographics, because it does matter whether the patient is over the age of 50 or not, because when you're over 50, the odds of hospitalization and death go up by quite a bit. So taking all these factors into account, for a full-blown national scale epidemic in North Korea, our model predicts that there will be in the vicinity of 10 million adult infections. And of those 10 million, there would be about 280,000 people who are going to need hospitalization. So these are going to be people who have difficulty breathing, who most likely will need a ventilator or some other form of medical assistance. Calculating and estimating death is a little trickier because there are a lot of underlying conditions, like Dr. Kwak mentioned, that go into that calculation. So if you have diabetes, again, your hospitalization and death rate goes up, and we don't really have that information. So for death, our model predicts a pretty wide range from 44,000 to about 220,000. But again, as Dr. Kwak mentioned, the medical healthcare system, the equipment in North Korea is not particularly good, and over half of the people are malnourished. impoverished, so their immune systems are going to be weak. So when you take account these kinds of national disadvantages, I would suggest that the death rates are going to be much closer to the higher end, much closer to 200,000 than they will be to 40,000. Now, I think it's probably already obvious if you've been listening carefully to numbers that the numbers our model predicts are quite different from the models that the numbers that you reported earlier. So we're getting 3 million fevers and only 68 deaths, and that's very, very different from what our model predicts. And at this point, obviously, it's not clear whether all the fevers are COVID or not. But given that we're in May and most communicable common diseases like influenza tend not to spike, at least in the Northern Hemisphere, at this time. So it seems unlikely that a lot of these fevers are from those other kinds of common diseases. And also, the rate of increase, I mean, we've literally been told that these 3 million fever cases have occurred in the last 2 weeks. That's an incredibly quick rate. So something is not quite right here. So 3 million fever cases just doesn't add up to only 68 deaths. Even South Korea in the winter during its Omicron wave with such a high vaccination rate over 82%, I also live in South Korea, we had a death rate that was at least 100 times higher than what North Korea is currently reporting. So something here isn't right. Either the fever numbers are higher than they actually are, or the death numbers are lower than they actually are.
Right. And meanwhile, against that background then, Professor Kwak, concerns have been raised about the possibility of new variants emerging in North Korea, where the population, of course, is unvaccinated. Do you share these concerns? And if you do, what may be the broader regional implications of such a reality?
Well, I actually have two different thoughts in regard to that issue. Number one is the fact that these speculations, these worries are stemming from the fact that more the infectious the tally, greater the chance for the variant to occur, such as it happened in South Africa, where people were not so vaccinated and there were a greater transmission among the population, creating more chances for the variation to occur. So in case of North Korea, where almost nobody, we presume, to be vaccinated currently, there's that much greater chance that more people will be infected altogether at the same time, creating yet another chance for the variations to occur. So I do think that theory is quite scientifically backed up. So there would be a chance in case of North Korea also to come up with yet another new variant. But also the thought that even for those vaccinated, once infected, there could come a new variant that could dodge the immunity created by the vaccination. So even though minor, there are some people in the scientific world claiming that for those people infected despite having been vaccinated could still come up with a new variant. So those are the two thoughts that I have about North Korea, the situation in North Korea. However, also something that's worrying me is the geographical factor, that we are geographically directly connected to North Korea. And we also know that it's the fact that these COVID-19 can also sometimes be transmitted through animals, such as felines and stray cats and whatnot. So if just in case a new variant is to occur in North Korea, and I hope this doesn't ever happen, but if a new variant occurs in North Korea, which let's say evades all kinds of immunity, and is transmitted through animals that can travel to South Korea, that's something probably we should keep in mind and have a strict mode of screening and monitoring for any transmission that goes on in the borderline between North Korea and South Korea. But in a clinical sense, I do personally think that it's less likely. It's really not likely to happen in the sense that transmission occurring via animals, but also number two, because we've already been, not just been vaccinated, but we've had a huge wave ourselves through Omicron, we're partially, if I may belittle it a little, we're at least partially immunized against not just Omicron, but COVID-19 as a whole, just through the huge wave of the pandemic a couple months back. So I think in case if a new variant or COVID-19 itself was to be transmitted from North Korea to South Korea, I think we would have enough of a power of immunity to even still fight against that.
Right, and I hope you're right then. Professor Fendos, North Korea on Wednesday engaged in additional acts of provocation by test-launching ballistic missiles. How do these blatant shows of defiance, Professor Fendos, look to affect possible medical assistance to the regime from the international community?
So initially, my feeling about these missile launches, especially the ones in January, was that they were kind of a signal for help. Because January is kind of the month where we really started to get a handle on how Omicron functioned. That's when South Korea's spike was really in full motion. And I'm sure that there were many people working for the government in North Korea, and all they do is they sit there and they read news articles and they check out things on the internet. And I'm sure that the reports that they were writing were clearly sending warning bells to the very top that, okay, this is very serious now, and we might also be in trouble too. So my initial read when they launched all those missiles in January was that perhaps that was a method to try to signal to the international community that, okay, we know we're in trouble and we would like some help, please. And at that time, I felt like the most useful thing that they could get were vaccines. Obviously, they didn't get them, but this is also the time when North Korea opened up their rail service to China, which also suggested to me, given some of the things, the proclamations that Kim Jong-un made during the fall about every grain of rice being needed and food shortage being a reality, that perhaps North Korea had reached this kind of brink where they needed outside support, food support. They had to bring supplies in, but they were afraid to do it because Omicron might come in along with it. So I felt like initially that might be the strategy, that this was kind of a messaging system. More recently, especially with President Biden's visit, it's a little less clear to me exactly what the purpose of those missiles are. Obviously, historically, most of these acts of provocation have been to try to barter for concessions with international sanctions and things like this. But given how slowly North Korea has responded to both South Korean and American offers of pandemic-related assistance, I get the feeling that they're not really sensing urgency yet, which again relates back to my skepticism about the official numbers that they're reporting. At this point, I'm skeptical that they're actually experiencing as large-scale, full-blown an epidemic as they say they are.
Right, I see. Professor Fendos mentioned this, but Professor Kwak, North Korea, with regard to offers of COVID-19 vaccines, they've reportedly rejected it, citing breakthrough infections, and they've instead requested treatment support. Now, that being said, what medical support do you believe is necessary for North Korea?
Well, honestly speaking, I think a little differently from what Professor Fendos has just mentioned. I think the North regime actually, there's also a possibility that they actually have sort of gave up on the possibility to gain an opportunity to immunize themselves in the fight against COVID-19. Maybe it's already too dire for them to handle that they don't want to receive vaccines to prevent the infection, but rather they take this as a partial opportunity to be immunized through natural infection. But because they don't want too high of a mortality rate and people not becoming severe, they're only asking for symptomatic treatments and treatments for the disease itself. So in that regard, well, through whatever these supports that we can provide, obviously we could possibly provide manpower, sending them doctors and nurses who have experiences treating COVID-19 patients here and there. But also we could provide them medicine. But because we're also running very tightly on Paxlovid and Molnupiravir and etc., instead of those, we could possibly think about sending them symptomatic medicines, such as acetaminophen, such as non-steroidal anti-inflammatory drugs, maybe even possibly steroids, because as currently known, I think North regime is even lacking symptomatic medicines. They're actually suggesting that people be treated through natural hermetical disease, hermetical medicine and herbal medicine and whatnot. So we could think about alternative ways that we could provide and support them in this fight against COVID-19 as well.
Right. And Professor Fendos, while we're debating over the actual size of the outbreak there in North Korea, Radio Free Asia says that the lack of proper treatment has also led to a number of stillbirths in North Korea. Now, apparently pregnant women who test positive for COVID-19 are quarantined and offered 2 painkillers a day. What look to be the broader repercussions of such inadequate medical attention, do you think?
Yeah, so I mean, obviously, it's very unfortunate when people who need a certain form of medical attention don't get it. But on a larger scale, which I think is the direction of the question, it's important to remember that the North Korean regime, Kim Jong-un's regime, is the central pillar. It's predicated on the ability to bring competent leadership. And a lot of the internal propaganda system runs on this principle of presenting the Kim Jong-un family as a superior bloodline with elite traits that is just more competent at being leaders. And this is often called the leadership myth. And when you start having enough of these kinds of cases where the government is unable to provide things that people expect to receive or should or feel like that they should be receiving, things like adequate medical attention or food, things like this, you start to erode that perception that the current leaders know what they're doing or that the current leaders are doing a good job. So individual events like this may not have such a large impact on the social fabric or the political situation, but when you start to accrue a lot of these cases, a lot of these situations where people are dissatisfied or surprised at how they're unable to receive assistance, you might have some situations now where the people start to develop enough discontent that they start to question this propaganda and this myth of superiority that the Kim Jong-un family tries to maintain. If I may respond a little bit to Dr. Kwak, I am definitely of the opinion that North Korea is going to have a national scale epidemic sooner or later. My skepticism is about the numbers that we're currently seeing that they're giving out through their media. I don't think that those numbers at this time are accurate, just because the two don't seem to agree. But I am of the opinion that eventually there will be a large-scale, national-size epidemic. And looking at it from their perspective, they've probably already given up on the idea that they can get enough vaccines to cover everybody, which may also explain why they're more interested in medicines at this time rather than vaccines.
Right, which is also something that Professor Kwak had touched upon. Now, moving beyond North Korea, Professor Kwak, the last time we were here in the studio, we touched upon the rising cases of hepatitis in children. Now, in recent days, there have been growing cases of monkeypox in adults reported across Europe and the US. What more can you tell us about this fresh health challenge?
Right, so let me begin by saying monkeypox is not actually related to the animal monkeys. It's a family of smallpoxes that have already been quite thoroughly studied. They even have prevention methods and treatment antiviral agents that could treat them and also prevent them, but not enough in stocks worldwide. But we do know how it works and how it spreads. As far as we are known, the monkeypox transmits through very close contact, almost physical contact, through human fluids. So even though formally, scientifically speaking, it is known to be transmitted through respiratory droplets, that sort of a deal is more within a very proximate distance where a person is constantly coughing and sneezing, where the human fluid is actually directly touching the other person. So it's more likely the situation where a person actually comes into physical contact with another person, whether that be regardless of genders. But situationally, I think it is spreading through a very specific community. But also, we have to focus on the fact that it has already transmitted to many different countries, which is not normal. We would have used to see that the monkeypox only spread very geographically, focally within the regions of West Africa and whatnot. But now seeing the fact that it has been already spread to Europe and the US, it seems like it has already spread to many other different countries that we're not currently detecting these cases from. So there's a possibility of that, and the numbers of detection may actually grow very vastly in the nearest future. But we should also take into consideration the numbers are also very still small. We have barely counted about 80 confirmed cases so far, and there's a speculation up to about 50 or 60 more people could have been already infected with the monkeypox. So we still have to keep monitoring it, but I don't think it'll be as dangerous or tiresome as the COVID-19 was. In fact, I personally think that it will be absolutely no match to what COVID-19 was.
Right. Well, as Dr. Kwak has said, Professor Fendos, the global health body claims the current monkeypox outbreak reported in at least 19 countries outside of Africa is containable. Do you agree, Professor Fendos?
Yes, I do. And I think Dr. Kwak laid out the basic parameters very clearly that the degree of intimacy required to actually transmit the disease is much more than what you have for coronavirus. I mean, coronavirus being in the wrong subway car can literally get you infected. But here we are talking about sustained contact. So I do think, given the information we have at the moment at least, that this idea of a pandemic-sized or even a serious epidemic-sized spread of the virus in the tens of thousands or hundreds of thousands is very unlikely.
Right. And Professor Kwak, health authorities here have claimed they are closely monitoring the situation of monkeypox across Europe and the US. What are the risks of an outbreak here in South Korea, do you think, very briefly speaking?
Right, I think it's close to none. And also the KDCA recently reported that we have about 30 million stocks of prevention method available, which they're not going to use because we're in no worries of seeing monkeypox situation here. So I think it's not something majorly we have to worry about currently.
Right, I see. All right, Dr. Kwak, thank you very much for your time and your thoughts today. And Professor Fendos over in Busan, thank you for being with us as well.
Thank you.